Civilians in the Democratic Republic of Congo have been hit the hardest by the escalating violence caused by armed conflict in parts of the country. Fighting between the government forces and armed groups has led to the deaths of thousands and displaced millions. The World Health Organization says cases of sexual violence are on the rise and disease outbreaks are threatening the livelihoods of people. The UN Health Agency is now appealing for more funds to assist the affected communities. CGTN's Muteri Kaibere reports.
The Democratic Republic of Congo is struggling to deal with a serious humanitarian crisis. Armed conflict and violence in the eastern part of the country has affected millions. Conditions there are getting worse. The World Health Organization says 6.3 million people have been displaced in just the last 18 months, and with people there having limited access to food, safe water, and proper healthcare, many face the risk of getting diseases.
DRC is facing its worst cholera outbreak since 2017. The eastern provinces are the most affected ones, accounting for 80% of the cases, with close to 30,000 suspected cases of cholera reported. The country is also battling the largest outbreak of measles recorded since 2019.
Children have been the most affected by the conflict. Many of them are malnourished. The WHO has deployed experts to affected areas to help respond to these outbreaks and also support victims of gender-based violence.
The combination of measles and malnutrition has severe health impact on children under 5 years of age, putting them at risk of dying with lack of access to adequate treatment. Around 23,000 cases of gender-based violence were reported in the 6 provinces from January to August 2023. These numbers are probably much higher, considering the low reporting by the victims and the weakness of health services to capture this data in a more exhaustive way.
Humanitarian agencies have stepped up their efforts to assist the affected communities, but more help is still needed. The WHO is appealing for $31 million to fund its relief efforts and health services in the DRC. For the vulnerable and suffering communities in the conflict-hit parts of the DRC, that help cannot come soon enough. Muteri Kaibere, CGTN.